would be great, and YouTube channel. Thank you. Give it a few more minutes. Okay, Michelle and Stephanie, we do have quorum, so we can start the proceedings. Thank you.
Great. Good morning, everybody. Welcome to the community Continuum of Care Committee meeting. Let's call the meeting to order at I have 9:32. My name is Michelle Jameson, and I'm with US Vets. I am the co-chair of the committee, along with Stephanie Smith from Native American Connections. So now we will start the roll call. Steve Dudasek will call each member's name and ask you to introduce yourself and your organization.
Good morning, everyone. This is the roll call for today's meeting. Vanessa Carthel.
Yes, present. Vanessa Carthel, Arizona Behavioral Health.
Richard Cruz. Daniel Davis.
More Daniel Davis from UMOM.
Kathy D. Nofi.
Yes.
Sorry.
Yeah, that's okay. Kathy Dinolfi and New Leaf.
Thank you. DC Ernst. Michelle Jameson.
Hi, present with US Vets.
Thank you. Wendy Johnson.
Wendy Johnson, present. Justa Center.
Thank you. Laura Magruder.
Good morning, Laura Magruder, Maggie's Place.
Thank you. Aaron Rain.
Aaron Rain, City of Mesa, I am present.
Thank you. Nikki Ramirez. Nikki Ramirez, you on? Okay, looks like Nikki, can you hear me now? Yes, Nikki Ramirez. Okay. Ty Rosensteel.
This is Ty Rosensteel from Crisis Response Network.
Thank you. Chayla Schuster. Sarah Sims. Stephanie Smith.
Morning, Stephanie Smith from Native American Connections.
Thank you. And Craig Tribkin.
Hi, Craig Tripkin. I'm with Cass.
Great. And Nikki, I see you are back on. Can you verbally introduce yourself? You're still muted, Nikki. Sorry.
Nikki Ramirez, Chicanos for La Causa.
Thank you. Okay, roll call is complete. Good morning, everyone.
Excuse me, this is Jennifer from Mercy Care. I think I was skipped.
Oh, I'm sorry, Jennifer. Thank you.
No problem. It's Jennifer Page. Thank you.
Good morning. This is Ann Johnston with Community Bridges. I believe I was skipped as well.
Okay. Thank you.
This is Melissa Leathers and proxy for Laura Skotnicki today from Save the Family.
Thank you. Okay, thanks, everyone. Roll call is now complete. Thank you.
Yep, thank you, Steve. For all participants, please mute your phone or your computer when you're not speaking, and please do not put your phone on hold. For all participants, we ask that you please identify yourself when speaking. We will also be reminding people do that throughout the meeting, as we have been advised that this is important for open meeting law. One final housekeeping item is all votes will be roll call votes. The roll call will be called after a motion is made. So we will now move on to Stephanie for the call to the audience.
Thanks, Michelle. Sorry, moving from my phone to my computer. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Any written comments submitted will be included in the meeting record. Were there any comments posted?
No comments were posted, Madam Chair. Thank you.
Thank you, Steve. We will now move on to Michelle for approval of the consent agenda.
I'll just give everybody a minute to look through the minutes if they would like. And okay, are there any comments from the committee on the minutes? Okay, thank you. Then we will move to sorry, I missed it. The update on the Maricopa Regional Board strategies. Is there any comments on that? Any discussion?
Michelle, this is Kathy. Do you need a motion to approve the consent agenda, or did I miss it? Sorry.
Thank you, Kathy. I do. I'm going to move to yes. Can I do both at the same time, Steve?
Yes, you can, Madam Chair, if there are no comments for consent items.
Okay. So Kathy, I am looking for a motion to approve consent items A and B.
I'll make that motion. Thank you.
Yep, thanks. Do I have a second?
Daniel Davis at UMA, my second.
Thank you, Daniel. So now we'll proceed with a roll call.
Okay, roll call. Vanessa Carthel.
Aye.
Richard Cruz.
Aye.
Daniel Davis.
Aye.
Kathy D. Knofleet.
Aye.
DC Ernst. Michelle Jameson.
Aye.
Wendy Johnson.
Aye.
Anne Marie Johnston.
Aye.
Laura Magruder.
Aye.
Aaron Rain.
Aye.
Nikki Ramirez.
Aye.
Jennifer Page.
Aye.
Ty Rosensteel.
Aye.
Shayla Schuster.
Aye.
Sarah Sims. Stephanie Smith.
Aye.
And Craig Tribkin. Craig Tribkin.
Aye.
Thank you. And just a note, the proxy for Laura Scott Nicky cannot vote to approve as she is proxy. So thank you. Okay, roll call is complete. The consent items were approved.
All right, thank you. And so now we'll move on to Stephanie for the next agenda item.
Thanks. I just wanted to point out that there's a message in the chat box that Shayla from Community Solutions is present. So next we will move on to agenda item number 4. Ty Rosensteel from CRN will present on the MOU between MAG and CRN.
All right, good afternoon or good morning, everybody. It's afternoon for me already. Hope everybody's doing great. I am Ty Rosensteel from Crisis Response Network. I am the director of our Homeless Management Information System and Database Resources. I get to present on a document that we are requesting approval of to be sent to the Continuum of Care Board for adoption. The document is a revision to the Continuum of Care Board's MOU with Crisis Response Network, identifying CRN as the HMIS lead. This is a requirement of the Continuum of Care from the U.S. Department of Housing and Urban Development in the Continuum of Care application process in order for either the collaborative applicant or the HMIS lead or coordinated entry to apply for funds. The Continuum of Care Board needs to designate the appropriate recipient for those funds. And so in this MOU, it outlines that CRN is that recipient, and it also outlines the responsibilities of CRN as it pertains to retaining that HMIS lead designation. So it outlines, the responsibilities that we have in terms of system administration, in terms of training, in terms of establishing user fees, establishing policies around data requests, around just many different sections. So the document that you have is one that we've seen before. It was originally established in 2018. There are a number of very small revisions, but we felt that we wanted to give the opportunity of the community to, again, review this MOU and to provide any input or changes that you felt were necessary. The other piece that I just want to add is that over the past couple of months, the MAG executive team and the CRN executive team and leadership have been working really closely to make sure that CRN is complying with all of these terms of the MOU. We're working really hard to increase our communication and transparency with MAG and ensure that we're prioritizing the needs of the community. One example of that is last meeting we presented the Continuum of Care data needs list of items that we're going to be working on. That was a collaborative approach between multiple teams at MAG, at CRN, with different committees and boards, and including yourself in that process. So I'm not sure that there's anything else that I want to add. I certainly want to give the opportunity for any MAG staff that would want to add any comments around the MOU or the process that MAG and CRN have in prioritizing projects and tasks, but certainly want to be available for any questions. Thank you, Madam Chair.
Madam Chair, this is Brandy Mead from MAG. May I comment?
Yes, go ahead, Brandy.
Okay, thank you, Madam Chair, members of the committee, and Ty. Just want to thank Ty for that overview and the presentation of the MOU. Completely agree with the comments that Ty provided. We have worked very closely with the Crisis Response Network on reviewing the MOU and did come to agreement around, as Ty mentioned, some minor changes to the wording and just kind of clarification. And we are working very closely with the HMIS lead agency on this. So just wanted to support the comments that Ty made. Thank you.
Thank you, Brandy. Were there any comments or questions from committee members? All right, hearing none, do I have a motion to recommend approval?
Vanessa Carthel from ABC, I motion to recommend approval.
Wendy Johnson, Justice Center, seconds.
Thank you, Vanessa. Wendy. Steve, you can proceed with roll call.
Thank you. Vanessa Carthel.
Aye.
Richard Cruz.
Aye.
Daniel Davis.
Aye.
Kathy Dinolfi.
Aye.
DC Ernst. Michelle Jameson.
Aye.
Wendy Johnson.
Aye.
Anne Marie Johnston.
Aye.
Laura Magruder.
Aye.
Jennifer Page.
Aye.
Aaron Rain.
Aye.
Nikki Ramirez. Nikki Ramirez. Thank you. Ty Rosensteel.
In an abundance of caution, I'll abstain from voting.
Oh, right. Yeah, abstain. Thank you. Jayla Schuster.
Aye.
Sarah Sims. Stephanie Smith.
Aye.
And Craig Tripkin.
Aye.
Thank you, everyone. The motion is approved.
Okay, thank you. We'll now move on to Michelle to the next agenda item.
Great, thank you. So we're going to talk about the racial equity, and Nikki is not here, correct? So it'll be Sarah.
Yeah, Sarah and myself, Madam Chair. Thank you.
Okay, we'll provide an update on the racial equity work group or work. Thank you.
Thank you, Madam Chair and members of the COC committee. My name is Sarah Kent and I'm a Human Services Planner at MAG. And Steve and I will provide an update on the Racial Equity Leadership Team and Action Plan. Nikki Stevens, unfortunately, cannot be here today. After the last board meeting in February, the Racial Equity Leadership Team met to begin planning on the 4 areas addressed in the Racial Equity Action Plan, prepared, of course, by the awesome Racial Equity Partners that we're all very familiar with. The 4 areas that we're working on first are looking at data, second, coordinated entry, third, involving folks with lived experience, and lastly, workforce development. So presently, work has begun within the data component to track inequities with inflow and outflow. Thank you to HMIS and Ty's great team. The Coordinated Entry Subcommittee has been meeting to incorporate racial equity language into their policies and procedures and operations manual. For the lived experience part, a plan is being developed to incorporate those with lived experience with homelessness into all continuum of care activities, of course, with a racial equity lens. And then lastly, we continue to look at various best practices from around the nation so that we may enhance opportunities for people of color to become employed and to ensure opportunities for leadership positions. And that concludes the update on the Racial Equity Action Plan. I thank you all so much for your time. And Steve, do you have anything to add?
Yes, we're very excited that, this committee recommended approval to the board for the action plan, and the board went through and did approve it. And now the actual work begins in these 4 areas. We want to be able to involve all of you in these efforts. So right now we're just beginning the process. So very excited to enhance racial equity throughout our systems, both in the practice side of things and the workforce development side of things. Particularly excited too about, really looking all of us together. How do we involve folks with lived experience more into our COC activities across the board? So it's going to be an exciting rollout, and we are very much looking forward to working with all of you as this process begins to be implemented. Thank you.
Great. Thank you, Sarah and Steve. Are there any questions or comments from the committee? All right, so now we will just thank you. We'll move to Stephanie, for the next agenda item.
Thanks, Michelle. We will hear from Ty Rosensteel from SEER, and again on the HUD 2020 system performance measures. Back to you, Ty.
Wonderful. I do have a question real quick. Is the presentation able to be brought up for me, or do I need to pull it up myself?
You would need to pull it up yourself, Ty.
Okay. Pulling that up now. My apologies, everybody. All right. Let's get this into presentation mode. And can I confirm that you're seeing the screen that is a full screen of the PowerPoint?
I can see it, Ty. Yes, confirmed.
Yeah, we've all got it.
All right, perfect. Thank you so much. So good afternoon, everyone. Oh, it's still morning, isn't it? Ty Rosensteel, Crisis Response Network. I get to share on the most recent system performance measure submission that was completed by our Continuum of Care. The submission was due to HUD on February 28th, and we did successfully submit our system performance measures on that date. The date of the submission was for last federal fiscal year, so the presentation and materials will be through September of 2020. Normally when we've done this presentation, we'll break it down into quarters. Because of the submission, we're going to break it down into the years and just show what the actual numbers were that were submitted each year. Again, just a general framework for this conversation is that we like to present this in terms of the federal framework from USICH of ensuring that homelessness is rare, brief, non-recurring, and that we're emphasizing job and income growth in our housing programs. So as we do the system performance presentations, we're going to be looking at each of the measures under those lenses. The measures that we chose today, there's 105 different measures that are submitted to HUD. We've narrowed this down to just around a dozen that are really impactful to the community and really impactful within our performance metrics that go to HUD through the NOFA scoring process for continuums of care in our collaborative application. And again, just to emphasize the importance of this, nearly 50% of the NOFA Continuum of Care application includes a discussion and narrative around the performance of the continuum of care. So there's a component of looking at the overall system performance via the metrics, but then there's also a discussion of what are the strategies our continuum is implementing and what are the outcomes of those strategies. The first measure is the total homelessness as measured by the point in time. The metric includes both sheltered and unsheltered persons. Of course, this is a metric that we're all very familiar with, knowing that our trend is going up in Maricopa County, and we want to see that trend going down. Second metric is broken specifically into a couple subpopulations. So the first subpopulation is family homelessness. This is, again, one that we're looking for the desired trend to be going down, and the trend is up. It's unclear what they're going to do for 2021. This metric does include both sheltered and unsheltered metrics. So that is significant both for this family homelessness as well as for the next slide, which is chronic homelessness. Chronic homelessness, again, is one that we're looking to have the desired trend go down, and the actual trend is going up. Veteran homelessness gets broken down into two components. This one is only the sheltered veterans. So you can see on the left, we have the targeted population. This shows sheltered veterans and then unsheltered veterans. So all of these metrics were point in time metrics. You can get more detail from the comprehensive report and infographics that MAG releases on the point in time count. Those are much more appropriate in terms of their depth of analysis. The reason that we're sharing this is because it is kind of the whole context of system performance that is submitted to HUD. The next slides are those metrics that were actually submitted via the system performance measures. So the first system performance measure is looking at the number of people that are first-time homeless. This is looking at a number of program types: emergency shelter, transitional housing, and safe haven. And we're basically looking at the total number of people that are entering one of these homeless projects that do not have a prior entry into the HMIS system in the past 2 years. So this is a number that we present on and make available through our Built for Zero metrics as well. So you can look at the inflow of new clients on a monthly basis for any of our subpopulations. This is the overall number, singles, families, all of these program types combined. The desired trend for this is to have a reduction in first-time homelessness, and that is the actual trend that we are seeing across our system. The next item is the length of time in shelter measure. This measure alone accounts for probably 30% of the values that we submit to HUD. They have a breakdown of mean, median. They have a breakdown of emergency shelters by themselves, transitional housing programs by themselves. This particular metric looks exclusively at the number of days that people spent in shelter, in emergency shelter, transitional housing, and safe havens. So this is a combined metric looking at all of those program types. And again, we're looking for a reduction in this. They're looking for fairly significant reductions. They're looking for 10% reductions. So they'd be looking for 9 to 10 day reductions as a system. And our trend is an upward trend for this past year. The next measure is the exits from shelter into permanent housing destinations. This is a measure that is collected based off of the destination field from emergency shelter, transitional housing, and safe haven providers, basically looking to see what is the percentage of people that disclose that they're moving to permanent housing and record that value. One thing to note is that this is looking at a system view. So if a person had exits from multiple shelters or transitional housing programs over the year, it's only looking at the last recorded value. So if they stayed at 3 different shelters throughout the year, and at each of those shelters they had 2 stays, that would be 6 different opportunities to collect this destination. As a system, this is only looking at the very last value. Next item is housing retention. This is probably the most complex of the measures that exist in terms of understanding. What I can say is that it's really looking at the people that have housing move-in dates in rapid rehousing, or excuse me, in permanent housing program types excluding rapid rehousing, to really say, did they stay in their unit or retain that unit during the time period. So obviously this is a number that we want to see really high. We're looking for people to stay in their units after they've received subsidy, or if they were unable to receive subsidy, that they were successful in finding a unit and retain that without subsidy. Over the past 3 years, that number had remained really stable, and this year we saw a slight uptick. So this is an area where our actual trend is matching the desired trend. Next metric is looking at returns to homelessness. We're looking to have a small number of people returning to homelessness after they have entered permanent housing. This one is interesting because there's 2 components to this. You're looking at the exit from a program and then a subsequent re-entry into another program. So this one, we're going to look at all program types for their exits, and then we're looking at returning to a homeless program. We did have a number of years, 2017 through 2019, where we saw this number gradually creep up, and then we saw this number drop back down over this year. An important part to this one is that it is a lagging measure. So for this data, we need to have 3 full years of data. And so it's a little bit hard because we're talking about exits that happened effectively in the 2018-2019 time period, and then evaluating their returns over the next 3 years. So it is a little bit hard to be able to view exactly what this looks like from a more immediate and live perspective, which is why in our Built for Zero dashboards, we have available the returns to homelessness metric on our inflow. So if you remember, I said that we have the newly homeless persons that we identify as part of inflow. We also identify returns to homelessness. And so we can track that on a monthly basis. We can do a more in-depth analysis of what that looks like. So I would say that those metrics are ones that are definitely ones I would recommend for further analysis and review in the future, rather than leaning exclusively on the system performance measure submission to HUD. I've got 2 last slides around job and income growth. The first one is looking at clients that are receiving continuum of care funded projects only. So this is only projects that receive continuum of care funds, and looking at the job and earned income growth during the time period. The biggest indicator here is looking specifically at earned income growth. So the next measure looks at total income growth, non-employment income. This one is exclusively around earned income. So seeing that we are increasing percentages of people with earned income is great. The increases from 2017 through 2019 is likely due to our increase in rapid rehousing stock during the time period, mixing in more rapid rehousing and more persons that are more likely to receive earned income. When we had discussed this previously, we all sort of had predicted that this would start to level off once that inventory had balanced. Seeing not a significant change from 2019 to 2020 does make sense. But it does indicate that we want to continue to find ways to improve outreach around, or may not outreach, improve engagement around employment programs. Last slide that I have is that non-employment income for persons in the continuum of care funded projects. This is again non-employment income, so we are separating employment from non-employment. And again, seeing actual increases as desired. Last piece here is that there are a lot of good conversations happening around strategies to really address these different measures. These are not, recommendations from CRN saying that we need to do these things. It's just an instance to encourage conversation that says, if we want to look at one of these particular strategies of making homelessness more rare, there are very well defined strategies that could be implemented around making homelessness more rare. So making sure that we say not only what are the strategies that we want to implement as a community, but what is the reason for doing that? What is the indicator that we're really looking to emphasize? So that is the presentation that I have today. I'm happy to go to any of the slides and answer any questions that the group has. Thank you so much for your time.
Thank you, Ty. I do have a quick question regarding the income measures. Is maintaining income captured in that, or only increases? You're on mute.
Thank you so much. So within the system performance metrics, it is looking for increases in both of these metrics. So that is different than the provider performance metric. So when you look at the Continuum of Care APR, individual providers are evaluated on maintaining employment income and maintaining the income for non-employment. But as a system, HUD is looking for increases in these measures. They want to be able to see that the system as a whole is putting the time and energy into the development and growth in these income. And it's sort of, I would say that is a contentious issue amongst HUD TA conversations that I've been in, where they will evaluate providers on one thing and then the system on another. But that is the rationale that they have, that as a system, we should be looking at income growth. And as an individual provider, providers should be looking at maintenance and growth. Does that make sense?
Yeah, thank you. Any other questions or comments from committee members? Oh, sorry, go ahead, Craig.
Okay, thank you. Ty, could we go back to the housing retention slide?
Yep. Is this the one you're looking for, Craig?
This came by very quickly and I didn't have a chance to digest it as it happened. There was the next slide also was people who we lost in housing. I forget how it was termed. But what's the next slide? There we go. Returns to homelessness. What is? I didn't have a chance to look at this closely. What is the measurement time frame for what we're asking about in this case about returns to homelessness? What's the start date and end date for them entering housing and leaving housing and measuring it?
A great question. So for this measure, it looks like I do have an error here for this date. It should be listed as 9/30/2020. Gosh, in order to really explain this, it gets into a lot of detail of when a person exits and then their time period for returns. So the exit time period is 2 full years ago. So the person is exiting from October of 2018 to October of 2019. And then we're looking at their returns from 2 years after their individual exit. So it's not a 2-year time period where it would be anyone. You're literally tracking that person's exit and following them for 2 years. So the data for exits needs to be a full 3 years old before we're able to track this for a 2-year measure. So I'm sorry that was so wordy, Craig, but it's unfortunately something that the precision is important.
Is the difference between 2 and 3 years, is that with the assumption that they exit after a year? Is that, and then we start measuring? Is that what that meant?
Yeah, so the issue is if a person were to exit homelessness in January, you would still need to track that person for 2 years. And so for that person, you would only need 2 years of data. But for the next person that exits in December, you need to track them for 2 years as well. And so because you're allowing for an evaluation of exits over an entire year time period, you need to allow for a really long band of returns around returns to homelessness around each of those persons. So, okay, so to make this really simple, we're looking at persons that exited in a 1-year time period. And then for each person, we're following them for an additional 2 years. So we're looking at a person that exits in March, we're going to look for their next 2 years of data. And so to do that, we need a full 3 years of data to evaluate anybody that would exit in a 1-year time period.
I get you. Now, and when does the clock start when they move into housing, or does it start when their subsidy stops?
So this metric, the program type, the metric looks at exits from an exit to permanent housing. So the clock begins exclusively based off of the destination recorded at time of exit from any program. So it actually does not consider subsidy. It does not consider housing move-in date. It simply is looking at the exit destination and the date in which a person exited homelessness.
So if we're, just so I understand, the first 6, 10, 12 months, whatever, of this measurement system, of the 2 or 3 year measurement system, includes the subsidized period of time.
So this one, I think that you're potentially thinking that this is a little more complex than it actually is. So if we're looking at a permanent housing program, like a rapid rehousing program that has an enrollment period and then they lease up with the person, the time period for that person does not actually begin until the end of their subsidy, until they actually exit a rapid rehousing program. So at the end of that rapid rehousing program, they would have an exit and a destination of rental by client. That's when we would begin evaluating the person, looking for them to return to homelessness.
Okay, so if I said that 18% of the people return to homelessness after they stop having subsidies for their housing, am I accurate?
The only problem with that, Craig, the only problem with that statement, Craig, is that this includes all program types. So it includes emergency shelter, it includes street outreach, it includes transitional housing. So it includes all of the program types where persons are not in housing during their enrollment, they would have no subsidy. There is a breakdown that includes only permanent housing. So again, like I had mentioned, there's 105 different measures. There are measures of returns to homelessness for emergency shelter, emergency homelessness for street outreach, returns to homelessness for permanent housing. I would be more comfortable of getting that metric of persons that return to homelessness out of permanent housing and using that number, then your statement would be accurate.
So these numbers include shelter
of
too.
all program types.
Sorry to be redundant. So these numbers include shelter period of time also.
It doesn't include the shelter period of time, but it begins when the person exits from shelter. So if the person is in shelter for 60 days and then they exit to housing in March, that it would be that March date that we would begin evaluating their return to homelessness.
Okay, thank you.
Daniel Davis at UMonty. I have a couple questions. One, this might be included in your 105 metrics that you report, but is there further breakdown on recidivism by intervention type? And it sounds like there is. And then also exit destination.
Yes. So for each of these metrics, there generally is a breakdown by individual program type. So there is a breakdown for each of these. Yes, that is correct. So for returns to homelessness, they have a section on street outreach, emergency shelter / safe haven, transitional housing, and then permanent housing. We locally can do a separation between rapid rehousing and permanent supportive housing.
Awesome, thank you for that. And then actually, if you could go back to the presentation, I wanted to follow up on just kind of the recidivism question. So if our PIT count time is increasing, but our first timers is decreasing, how are we showing that returns to homelessness are decreasing? If you can go back a couple slides to first timers. I'm just trying to see if it's the 3-year lag that you're talking about.
Let's see.
So this is decreasing.
Can you walk me through what you're looking at, Daniel?
I'm sorry?
Can you walk me through the question that you're asking? It sounds like you're looking for the interrelation between two different measures, how they would interplay.
Yep. So our PIT count is increasing year over year over the past 4 years. And we're showing that our recidivism is decreasing, but our first timers for first time homelessness is also decreasing. So PIT's increasing, first timers is decreasing. Wouldn't that show that recidivism is actually increasing? And I'm wondering if that's just caught up in the 3-year lag that you're talking about.
Yeah, I think the piece that comes to mind for me is additionally that for each of these measures, we're looking at different program types. So I really like what you're describing though, Daniel, trying to put together a comprehensive picture, right? How do these interplay? How is our system operating as a whole? I think that is the type of work that we want to do, right? To be able to really begin to create narrative around these so that we can do appropriate strategies. So I think that what you're describing is the work that needs to happen in our community. For each of these measures, to really tie together those narratives, we would want to get into the precise details of which measures are included. So for first-time homelessness, this does include emergency shelter, transitional safe haven, but you'll notice what's missing is street outreach, right? Street outreach is not included. And when you look at our point in time numbers, what's really driving our point in time number increases is our unsheltered population. The unsheltered population is included in our returns to homelessness. So we can look at street outreach returns to homelessness. But I think in order to be able to respond to your statement, we'd want to look at really the more precise numbers and track those along the way. Does that make sense?
Absolutely, thank you.
Vanessa Carthel, ABC, just a follow-up on that question. So HUD defines which program types are included in these measures. Is that correct?
That's absolutely right. There's a 40-page document that HUD produces that says here are the exact measures that we want from each continuum of care. And they do that so that they can get consistent numbers from each continuum of care nationally. That's right. If there were a necessity for us to make a modification, we have that ability to be able to say locally, we want to look at a number in a different way or in a more precise way. The one that comes to mind for me is the returns to homelessness. They combine rapid rehousing and permanent supportive housing into a single row of permanent housing. Anytime we've done this presentation with more details, actually breaking those out, there's always been the request to break that out into rapid and PSH. So if we needed to do additional analysis, we retain all of the client level detail on these so we can do those sorts to be able to pull more precise metrics.
Madam Chair, may I comment?
Yeah, go ahead, Brandy.
Okay, thank you so much, members of the committee. Ty, thank you so much for this presentation. This data is great. It's really important to be able to track the system performance measures. So it looks like in all of the data that you presented, and I know that there's more to digest, but it seems like the trends are going in the right direction for the categories that you presented on, except for one area, and that was the length of time in shelter, where we were going against the expected trend, well, and overall homelessness as well. I really appreciated the slide, the very last slide that you presented on strategies that the continuum of care could be working on to impact these system performance measures. Would you be able to share that last slide again? I think it was around homelessness being brief. You had a couple of, yes, this one. So increase rapid rehousing and then targeting long-term stayers. So it seems like those are a couple of strategies where if we were wanting to turn that system performance measure around, focusing on those two could have an impact in the community. Would you agree with that?
So I just very specifically, so first, yes, I absolutely agree. The other thing I would just say is that metric is really interesting because it basically is identifying the number of people that have access to shelter. So if you think about it, because we really are not having huge fluctuations in the number of beds that we have, our length of time in shelter is driven very directly by the number of people that are served by emergency shelter programs. So the real trick is to be able to find ways to increase flow through in the shelters. And we've done a number of presentations in the past around targeting long-term stayers, and we even have a board prioritization around long-term stayers. And so I think that there's definitely opportunities to try to find ways to encourage homelessness to be brief based off of the strategies that we have in our other housing interventions. This really is not something that the shelters can do on their own, right? It's very hard to say emergency shelters, you need to decrease this length of stay, because they could artificially do that, right? They could just say, okay, great, we now have a 30-day length of stay. At day 31, our policy is that you now have to leave, right? So, shelters could artificially decrease that number, but that would negatively impact other areas. So I definitely appreciate what you're sharing, Brandy, of trying to find more systemic ways to be able to address this, particularly through housing intervention.
Great, thank you so much for that, Ty. And I think this is, I love that you shared this last slide. I think being able to look at some strategies that we could implement across the continuum to further improve our system performance measures is very helpful. Thank you.
Are there any other questions or comments from committee members for Ty?
This is Daniel from UMO again. I just want to say, Ty, awesome work. You and your team have done a lot of great work representing our community, and I especially appreciate this last internal strategies for us to improve as a continuum. So thank you.
I appreciate it, and I really appreciate the conversation about trying to create a bigger narrative here, right? The data does not describe itself. The data by itself is insufficient. Being able to conduct additional analysis, create the narrative of what's actually happening, and pair that with strategies for impact is really what I hope will be next steps in our community.
All right, if there's no other questions or comments for Ty, we will move on. Thank you again for all of that, Ty. Great work. And I will hand it back over to Michelle.
Thank you. So next, Maggie Wan, she will go over the MEG analysis, or she's with the MEG analysis department, get that done. And she'll just demonstrate the new interactive mapping tool. So Maggie.
Hi there. Thank you, Madam Chair and members of the committee. Can you guys hear me okay and see my screen? Awesome. So good morning. My name is Maggie Wong. As Madam Chair said, I am with the Regional Analytics Division here at MAG and very excited to have this opportunity this morning to demo for you all a draft version of this homelessness assets map. So just for context, this is an interactive mapping tool developed in partnership with Crisis Response Network and the HMIS team, as well as 211 Arizona and the COC. So the data comes directly from the 211 Arizona resource directory. We identified services that target or frequently serve populations experiencing homelessness. And then other data comes from the HIC, the Housing Inventory Count, which is conducted annually for all shelter and housing programs, except for all shelter and housing programs in the Maricopa County region. So we've mapped all of these, excluding confidential locations. So the purpose of this tool really is to visually, spatially visualize where services and programs are located across the Maricopa County region for better regional planning and coordination. So to have it all in one place where users can go in and just see what we have and where we have it. And then also provide some information on inventory from the HIC. So before I start, I do want to note that this is still a work in progress as we review and incorporate feedback from stakeholders. It's currently in this draft mode in order to get that stakeholder input on the data itself, as well as general features and usability. So if you have a chance to play with it, definitely let us know what you think. All right, so this initial view here has a welcome screen. It's a little pop-up and it'll take you through a brief tutorial. I'm going to click through pretty quickly. But it really just shows off the different features of the interactive map so that a user understands the different parts and how to use it. This tutorial also can be accessed again by clicking the help button at the top right. And then you can also kind of skip it if you already know how to use the map. We also have this about section, which provides some background on the map. Sorry, is it not loading? Oh, there we go. It provides some background on the context of the map, as well as a bit of methodology. So as I mentioned before, it's using the HIC, but as you may know, we have not submitted the 2021 HIC yet. So right now what is on here is preliminary HIC data. So it's using last year's 2020 HIC for existing programs. And then we also received some preliminary data on new programs that were entered after last year's HIC. So HMIS provided us with numbers from when that program was set up. And when we officially submit the 2021 HIC, we hope to update these numbers so that it's a better picture of what's happening in the region. So right away, you can see this initial view shows kind of a zoomed out view of Maricopa County with all these different icons. The legend shows that each icon represents a different category of program and service. So we've got kind of 6 general categories here. We've got shelter and housing programs, healthcare, clothing, hygiene, other services, which includes things like legal assistance, identification card, fee payment, and then ancillary services. So the ancillary services are programs that don't necessarily target people experiencing homelessness, but are frequently used by them. So for example, that could include things such as animal surrender services, bus and light rail service, and such. And then you can also see here that you can kind of toggle the visibility of each category on using the legend. So it might take a second to load, but basically when you toggle it, it'll turn off and on whatever you have selected. So that just turned off food and meals, and you can kind of go through and click through if you only want to show 1 or 2 of these larger categories. You may also notice there's 3 different filters up top. So you can filter all of these points by program type, city, and provider. And this is really to help people better, right now it's for people to better review. So for example, if one of you all wanted to go in and just check ABC's programs on this map, you can go in and select it here. A new leaf or any provider really can go in and just see where we have mapped your locations. And then we also are going to be sending this out to city and town planners and managers as well, so that they can review what's in their city and let us know if there's anything missing. If we are missing any locations, we do have this add program location button where we ask you to give us the provider name, the category, program type, and then there's this additional information box where you can leave additional comments, questions, and then we ask that if you do use this, please put the address there so that we can make sure that we pin it correctly on the map. But on the right here, there is a little map here where you can zoom in, and then you can click to draw a point at the exact location as well. So this is really to help us collect any missing information. All right, but if you wanted to review what's on here already, you can click on any of the points. Just a minute as it loads, but a pop-up will appear to show you what is at that location. And I do want to note, because some locations have multiple services or multiple programs, right? So they could be stacked. And in this situation, you'll see that right here, it says 1 of 20, which means that there are 20 different programs and services at this location. So make sure you kind of click through to see everything that's there. And you also may notice that some of these pop-ups are bigger than others. So for example, the first pop-up here is a bit short because this comes directly from the HIC. So from the HIC, we're just getting the program name, the address, the housing type, whether it's site-based single site or tenant-based multiple site, and then the number of units and beds. But then for the records that came from 211, we definitely have more details, including hours, description, eligibility, and a link to the website. We are looking for ways to kind of build out the HIC side of things more. Part of that may come from you all. If you want to provide us some more information that is currently not on here, you can click this little feedback button, and that'll submit feedback specifically on that location. So definitely check that out. And then we do ask for a name and an email so that if we have questions, we can contact you. So the MAG team will be reviewing this feedback jointly with the CRN and 211 team to determine what changes to make, things to add, and ways to update, the databases that these came from. But I believe that's it for the demo. I want to mention again, since this is a draft version, we are looking to add more features in the future, including different base layers. For example, adding the PIT count or outreach concentrations. So where are we encountering more folks experiencing homelessness? Are there areas that could use more targeted services and programs? We also are looking to bring in contextual layers such as poverty, vulnerability, using census data. That way we can kind of see how the need maybe matches up with the supply. So that's really the bigger vision for this tool. And so we're really looking forward to hearing your feedback, making sure we have the right locations, the right data, and then any other suggestions on the tool itself. So thank you so much for your time. If anyone has had a chance to play with it and has any feedback or comments or questions, please let me know.
Thank you, Maggie. Wendy Johnson had a question saying that if a site or a comment, site has multiple services, we need to add program buttons.
Let me see real quick. We need to add program. Wendy, are you on to kind of elaborate on that?
Yeah, sorry. I just switched over to a headset so that it could, I could be heard without all the echo chambers. So am I coming through okay?
Yes.
Yes.
Okay. Yeah, I had a couple of questions about the map. So like the LDRC example is crystal clear. When you get to like St. Vincent de Paul or Justice Center, where we have multiple types of programs that like shelter, we have a housing program, but not a shelter program, so do we go in and go, okay, we do meals on these days, for these people? Do we add an event or whatever program, each program individually so that they come up when people sort them?
Yeah, right now we do have it set up in that way where each program and service is listed separately. We are kind of hoping to look into ways to collapse that for locations that have so many services, but we haven't quite figured out that piece yet. So if you could submit them separately or just confirm that they're on the map,
okay,
clicking through.
And while I've got the microphone, it would be helpful, I think, in the community to have some demographic buttons. Sorting services, age, like youth, seniors, and then, or young adult, pardon me, and then family services for sure. Because I think folks are going to assume they can get all things at these places. And I realize domestic violence shelters are confidentially, listed, but it would help if there was you know, like a button for domestic violence that gave you a list of phone numbers or something. Because, you know, people are not gonna go and Google domestic violence shelters separately if they're here and getting everything else they need. We've needed this for a very long time. 211 is incredible, but being able to map it and to narrow down what it does, what each of us do, is huge. Will this be scalable to mobile devices?
We are hoping to be able to do that. It will take some work, but potentially in phase 2. Yeah, mobile friendly is the goal.
Great. Thank you so much for your work, all of you.
Thank you, Wendy.
Thanks. Really great questions, Wendy. Thank you. Is there any other questions?
Yeah, I've got a question. Actually, two. How do I access this tool right now, the beta version of it?
Yeah, so I'll drop this link in the chat. And just as a note, again, it's a draft, so it's not meant for public use, but it's meant for stakeholder input. So definitely want to get that out to you and your teams to review and let us know. So I will put that in the chat right now.
Second question is, it seems to me it's a different client market. Why are shelter and housing smashed together in this? And I just tell you, politically, you know, it's harder to cite shelter than it is housing. Housing isn't easy, but shelter's even harder yet. What's the reason?
To be honest, there wasn't a specific reason. It's because there were so many categories, we were trying to shorten them. If you believe they should be separate, we could definitely have the conversation about that and separate it out for sure.
I really do. I do think it's a different target, not a different target market. It's a different stage in the market.
Mm-hmm. Definitely noted. Thank you. Another thing I wanted to mention that Wendy's comment reminded me of is that Ty had a really great suggestion of adding coordinated entry points to this map as a separate category. Yeah, the idea right now, you know, is the primary purpose now is for planning, but down the line, we definitely want this to be available to all outreach workers, to people searching for services themselves. And so having those buttons so that people know how they can access the services and enter our system will be really important. So that's something we'll look to add along with, as Wendy mentioned, kind of domestic violence hotlines and such, that type of information. So if you have any feedback on that, things we should definitely include when we get there, definitely let us know as well.
And Maggie, how do we give feedback, or who do we send it to?
So on the map itself, in the About section, you'll see there's 2 contacts. We've got Sarah Kent on our end, and then we've also got Rebecca from the 211 team. So you can email us there, or really reaching out to anyone on the MAG team. They'll make sure that the feedback gets to the right person so that we can get these incorporated.
Are there any other questions?
Yes, this is Stephanie Smith from NAC. This is intended for providers to be service providers to use as a resource. I guess concern question, I'm thinking like specifically to our projects. I don't know if there's a way to let people know, like, I'm just going to throw it out. It's not very finessed, but you can't just show up to one of our housing projects and fill out an application and, you know, like there's the whole process. So I don't know if like there's a way that can get built in that, I mean, of course, we're not going to just turn people away. You know, we're going to give them the coordinated entry spiel that we have and, you know, provide that information and the flyers and everything. But I wouldn't want people to waste time going between all the housing providers to keep getting told the same thing, especially if they participate in coordinated entry. So I don't know if you guys have talked about that or thought about a way to like filter that through, if that makes sense.
It really does. And thank you so much for bringing that up. You know, I think that's something we hadn't considered yet, just because, like I said, the primary audience, first of all, is for planning. So for providers and for city and towns. But yeah, as we open it up, we definitely want to have disclaimers on here. We want to have, you know, pop-ups to explain, you know, you can't just show up at a provider. So I think that'd be great to work with you all and maybe even the coordinated entry subcommittee to get the language around that and start testing it and make sure that any general user who goes on here understands that while we are showing all the locations, that does not mean that you are immediately served. I'm really glad you brought that up, and that's something we definitely want to be mindful of as we start to publicize it, for sure.
Yeah, that's a great question, Stephanie. And I'm wondering, as if you go over a location and you mentioned a pop-up button, if one of the pop-up buttons would be click how to, like, to refer them to a coordinated entry or tell them where to go or how to proceed.
Absolutely.
Are there any other questions? All right, well, thank you. And now Stephanie will introduce the next agenda item. Thanks, Stephanie.
All right, thanks, Michelle. Next, we'd like to introduce Josoni Goodman from Glendale Works program, who will provide an overview of the Glendale Works program.
Hi, everyone. Can everyone hear me okay?
Yeah, and we can see your screen.
Great. Thank you so much for allowing Phoenix Rescue Mission the opportunity to be able to present on the Glendale Works program and the good work that we do. We can go to the next slide. So this is information I'm sure everyone on this call already knows about, but basically this is where it all started. So there was a need of growing unsheltered homelessness in the city of Glendale, and the city of Glendale reached out to us and they asked, what can we do to help remedy this problem, and how can we creatively, work to address this issue? And so based off of that, we launched we implemented and launched this program on November of 2018, and we have been going ever since. We can go to the next slide. So basically, what is the purpose of this program? So the purpose of this program is really to, have individuals who are experiencing homelessness, make an honest wage. It was really an opportunity to tap into the population that we refer to as services resistant or chronic, that might not be interested in services, but they might be interested in maybe coming out and making a little bit of money. And the caveat to that is services on the back end. So yes, you can come out and yes, you can work with us, but we want to be able to, like it says there, inspire you to do something different and motivate you into choosing to end your homelessness and making you the owner of that change, and us assisting you in that. And so through repeated interactions with individuals out, working these day labor programs, that's how we're able to develop relationship and rapport to encourage them to do something different, because many of the people that we do serve have been homeless for quite some time, or they might be just resistant to tapping into various services that are available to them. We can go to the next slide. So this kind of provides an overview of the program. So the Glendale Works program basically works with the city of Glendale. We have a contract with them, and we tap into what the city needs. So this is the great part about this program, is that it not only serves individuals who are experiencing homelessness, but it also serves and fills in a need for the city. And the city was in need of beautification projects with their parks department. And over time, now we also have a second crew working out in the landfill department. So they needed, the labor. They needed something that was affordable to them. And so, and we wanted to provide a service. So it was a really great way for us to be able to partner. But we provide basic landscaping, trash removal. Like I said, we work out in the landfill. And then we also provide case management. So we have our coordinators coordinating the project. So we pick our individuals up. First we register, then we pick them up, and then we take them out to work. And while they're out there working or after their shift is done, we connect them with case management. So we have case managers that work out in the city of Glendale that come during the shift. They come after the shift. They come before they get their payouts and after they get their payouts, and they offer services. And sometimes it could just be one step at a time. Hey, you know, you lost your ID. Let us help you get that. You need your birth certificate. Let's help you get that. And then, you know, by building relationship and rapport, hopefully trying to navigate them towards housing, or if they're struggling with some sort of substance abuse issue, being able to help them get connected to a recovery program or reconnection with their mental health clinic, whatever it may be. We want to be able to connect them to what best fits their needs. And lastly, the workforce development piece. So in Phoenix Rescue Mission, we have a vocational development program. So we're able to help individuals obtain work. So not just with us, but something more permanent. So we help connect them with GED, high school diploma, helping them, you know, do job searching, helping them with any type of, you know, if they need work boots or anything like that. We try to help them get connected to whatever it is that's going to help them be successful in this new employment. And alongside the employment, we're also working to house them as well, and get that that process going. We can go to the next slide. So this here kind of gives you just a snapshot of just what the outcomes of this program have been. So this data goes from the beginning of the program from November of 2018 to December of 2020. So this kind of gives a snapshot of where we have been thus far with this program. So 469 unduplicated individuals is who we have been able to serve. And those bottom metrics are really what, you know, we're excited about, just to be able to help people get job placement. Those placements there can it's all encompassing as far as whether they're coming into our internal residential recovery program, whether they're going to an external program residentially, or whether they're going to permanent housing. And then the last is what we have been able to serve the city of Glendale with. We can go to the next slide. This is just a quick snapshot. Some people like to see what the work is, and this is just a little wash area. And basically, you know, our team went out there and cleaned all of that up, and that's just a little snapshot of what the city of Glendale gets to receive out of this. We can go to the next slide. So I wanted to be able to present a little success story, kind of make it, you know, related to a specific client or clients in this case. We had two participants who came out and started working with us, and they were a little bit, you know, I guess you could say, mistrusting, didn't really know if we would be able to help them. They were kind of a little standoffish, but they were willing to at least come out and work. And so we started to develop a relationship with them, and they were a couple. Well, along the way, the female client ended up pregnant, and they really started to consider, okay, you know what, I think we're serious to get connected to housing. So we were able to, you know, do a housing assessment with them, the VI-SPDAT, get them connected, help them get a voucher. They were able to move in, and just in time for this little baby girl to be born. And so now they were able to get successfully housed, and they're still successfully housed. And our case managers, you know, still are in contact with them to provide them any type of supportive services along the way. And we can go to the next slide. And this just kind of summarizes where we're at today. So we were able to increase the amount of individuals that we served through this program in the city of Glendale. So we went from 5 participants to 20 participants a day. So we take out 2 crews of 10. 10 of them go to the landfill, 10 of them go to the parks department. And so as a result of just more participants being able to come out, we we are able to have therefore more interactions and more placements into some of the services that are listed there. And so, you know, one of the great things that we have been able to see as a result of this program is, you know, at first there was a lot of talk of, well, if you're just going to pay them, they're not going to want to do anything. But it turned out that a little bit of restored dignity, it really went a long way. And people started to ask, how can I get my own job as a result of coming out and spending a little time with us? And so we started to see that kind of rolling over into their relationships with other participants that were going out, and they all know each other. So seeing one be successful and be housed or go into a program and reclaim their life has gotten them interested in potentially wanting to do the same thing. And so it's been a very interesting journey to see how all of this unfolds, and being able to see the success of it. But I think that's all I have, so I'll open it up to any questions.
Any comments?
This is Richard Cruz from the Human Services Campus. You may have covered this in your presentation, but are they paid a stipend or are they paid a wage? And if so, what is the wage that they get paid when they're going out to do the landscaping and landfill work?
Absolutely, yes. So it is a wage, it's a daily wage, and it's $60 for 5 hours of work. They receive a breakfast, they receive lunch, and you know, we basically we treat them just like as if they were contracted employees. So they come and they work. It is a sign up registration type of deal. So, you know, we're not serving the same people every day. In fact, we look at the amount of people that we're serving and how often they're coming out. And then we're having hard conversations with people after a certain point. You've come out 5, 10 times. You haven't worked with a case manager. How can we encourage you to get connected before we sign you up and have you come out for another shift? And so that's basically what that looks like.
Are you able to, when they do work with the program for a while and do demonstrate good work ethic, provide them with a letter of recommendation or something? So when they are looking for full-time employment, they may present that, because sometimes it's hard if they don't have the work history.
Absolutely. Yes, we have been able to do that quite a few times. So not only just providing the letter of recommendation, but also helping them develop that resume that lists out some of these skills that they're developing as a result of coming out. We're not able to be listed, I guess you could say, as an employer, but they are able to at least reference the work that they're doing, and then we can provide them a letter of recommendation, because they're not technically, I guess what you would say, an employee of the Phoenix Rescue Mission.
Madam Chair, this is Steve Dudasek. Could I ask a question of Josoni?
Of course, go ahead, Steve.
Thank you. Hi, Josoni. I'm just wondering, you know, during this work engagement, is your team also helping folks develop job-based soft skills as well as the hard skills, as you know, the concrete work effort? Is soft skills part of this, you know, development of the workforce?
Not entirely, because we are working with individuals that require just a lot of hand-holding throughout the day. I mean, as far as, you know, asking individuals to communicate, asking individuals to, you know, practice being honest, you know, that goes a long way, because a lot of the individuals that we serve, you know, unfortunately are coming to us recently, maybe using they're addicted, or they're struggling with a mental health issue actively. So we try to do as much as we can, but unfortunately, true soft skills and being able to exercise that and implement that is something that we have not had an opportunity to fully introduce as of now.
Thank you. I appreciate that. One of the things just to comment, I liked what you said about, using work as an engagement piece into services, and also, more importantly, work as often a builder of one's self-esteem. I'm putting on my rehab counselor hat because that's what I am. I love this stuff. And it really points to the idea that work talk, or even the talk of work, is impactful in an individual's process to become stably housed. So I appreciate that you had that observation and seems to be working. So thank you, Josoni.
Yes, thank you.
Daniel Davis from UMOM. This was an awesome program, and you might have addressed this in your presentation already, but do the supervisors of these teams or any of the onboarding responsible parties receive any sort of trauma-informed training or harm reduction training? One thing I've learned in helping employers become supportive employers is that, when somebody shows up late for the first time, that's probably the greatest opportunity to make an impact on their soft skills. So we've worked with Social Spin to do different trainings like that and stuff, but I'm wondering what have those efforts been like for this program?
Yes, so the coordinators who manage the participants who are coming out and working the program, they are all peer support certified, and they all undergo various trainings, motivational interviewing, trauma-informed care, as you mentioned, as well as harm reduction, and various other trainings that we offer. So yes, we definitely do ensure that is something that they are fully trained and capable of using out on the field with the participants. Even though they're not case managers themselves, we still find that like you said, it is really important for them to know how to develop those relationships and motivate individuals towards the services that are going to be offered to them either during their shift or after their shift. And so, yes, I mean, when the question was asked about the soft skills, I guess really it was, are we truly focusing on that and intentional about that? Like we're actually looking into developing those skills intentionally. Unfortunately, that's a really great point, and we have not yet fully implemented looking into doing that. But as you did mention, when people are late or when people are doing things that they shouldn't be doing, and when people are causing disruption during the workday, things like that are all being addressed as people are out there working. So it's not happening. I guess just the intentionality is what might be lacking.
Awesome, thank you. I know that maybe working with the governor's office for their, whatever that credential is called, I can't remember, it's been a while, but that would be a really, Arizona, I'm sure somebody knows the credential through Trevor Stokes' office, well, the office he used to hold, but that's a really valuable resource for employers. Also, it'd be really cool if this could be a model for other employers in the private sector, in a way that the public sector could help us engage employers and get them on board with this model. So thank you.
Yes, thank you. That is definitely something that we are looking into, is how can we have already experienced an expansion of this program outside of the city of Glendale, because now this program operates in the city of Scottsdale, but being able to look how we might be able to serve in a more, like you said, private sector is something that we're definitely looking into, because we partner with the cities because the cities need this and are asking for this. However, our goal is just to serve primarily the client. So we would be willing to look into working with the private sector in order to be able to just advance working with more clients.
there any other questions or comments from committee members? Hearing none, thank you again for presenting today, Josoni. We appreciate
Yes.
it.
Thank you.
Michelle will now lead a discussion on the next agenda item.
Hi, February 10th meeting, we talked about the eviction moratorium and how it may be coming to an end in the end of March, and I'm hoping that it is extended. We talked about getting an ad hoc group together, but the board, as we have discussed, is going through strategic planning, and they need to provide. They need to go through the governance on ad hoc groups. And so what we need to do today is just maybe discuss if we want to go ahead and form an ad hoc group, but what that would look like, what the goals are, the tasks, the time frame. And then once we put that together, we can present it to the board to see if they would approve an ad hoc group. So I guess this is just open for discussion on if we feel we'd like to make a plan to present to the board. Okay, I don't know. Okay, I feel I would like to do something as far as work with the eviction moratorium, and whether if that's not what we want to do as a group or ad hoc, but do we want to discuss it? Or I'm very concerned personally about the pending evictions, and what we can do our part as far as to get the word out and prevent that from happening.
Madam Chair, it's Steve again. May I make a comment?
Sure.
Yeah, hi, thank you. Yeah, I think, given our last meeting, we did discuss, or the committee did discuss resources that are out there. I'm just curious with this group, I mean, beyond that, what could be done proactively around to address the eviction moratorium? And I know there are groups such as the AZ Housing Coalition working on landlord engagement as maybe a tool to address this. And maybe there are other groups that are already established and are beginning real deep dive conversations around this work. I just want to throw that out to the committee members if they're aware of anything, or how the committee, if they so choose to be engaged in this, what the next steps would be.
Thank you, Steve.
This is Ty. Just in response to that, Steve, I'm curious what the best format would be for this work group, or for our committees to engage with those other groups. Because I think you're right. There are people that are having conversations. Our 2-on-1 teams are attending conferences that are happening statewide, and Hillary Evans, our community engagement supervisor, is on 2 of them. And so if we need to do a better job at participating and communicating these messages back to committees or work groups, I guess I'm curious what you think the best way to collaboratively work looks like. Is that selecting membership from committees to attend? Is that requesting that MAG staff attend and brief up on what this looks like? I really like the idea of not trying to create something new, but finding ways for the Continuum to collaborate with those other groups.
Madam Chair, I'm sorry, can I respond to Ty, or
Yeah.
Ty, were you asking me that question?
I think it was, yeah.
Oh, okay. Yeah, Ty, I do agree. Again, the committee members, I mean, I like to defer to what their ideas would be about this, but I will say, I do agree that, particularly with the eviction moratorium, that we needn't, start up something that's already been happening with conversations. If committee members are involved in any of the discussions going on, it would be great to have that feedback as well as, maybe people from your team, Ty, that might be engaged in that. So I agree with that, but I want to defer to the committee membership here to see what their ideas might be around this. I do definitely agree that this discussion and information needs to be shared and proactively approached with this situation.
Thank you. I guess for myself is I haven't heard a lot, and so maybe if we bring them back, have a guest speaker present to the group on like what is being done for eviction prevention in the community, and what are the resources. If there are other agencies, who are they? What's the approach, and how are we going forward to hopefully prevent as many evictions as possible?
Yeah, I think the piece that comes to mind, I really like the idea of us as a continuum of care to find the way to coordinate with these other groups. I'm not super familiar with it, but I know that Pima County has a coalition that is working together where they have lawyers, constables. I think they have a couple legislators that are on this call in addition to continuum of care membership. And it seems like, and I just might not be aware of that happening in Maricopa. But I like the idea of continuing the conversation of trying to create this work group, or us in some way collaboratively joining that. Certainly, if we wanted, I know that the Arizona Housing Coalition, like Steve said, is doing something. So if we wanted to, maybe ask Joanna or somebody at the Housing Coalition to come and present, and maybe we ask them this question, like, how do you think that we can be involved in the conversations that are happening? And that can be one of their talking points of what ways that the continuum of care could be supporting their efforts. That would probably be my recommendation.
Thank you, Ty. Are there other recommendations? Or
Madam Chair, this is Steve again. May I make a comment? Thank you. Yeah, to that point, again, with this committee membership here, I mean, all of you are leaders within your particular organizations. It may be beneficial for the committee to consider that if your particular organization is taking a proactive approach, or modeling an eviction prevention program, it might be beneficial for this committee to hear from your perspective, from your agency. Just want to throw that out there as a suggestion for the committee to maybe consider.
Daniel Davis at UMOM. I think it'd be appropriate to do an ad hoc work group. This is why I suggested it last time, because like Ty's saying, there are multiple conversations going on in the community, but some of them live at the municipal level, or some of them just providers. So I think just taking, the opportunity to analyze what efforts are going on, and then trying to fill in the gaps, because maybe Joanna would be the most appropriate person to talk to this committee, but also, maybe after the work group, Ty decides that it's more appropriate to have like an internal presenter and develop some recommendations. But sorry, Michelle, I didn't answer you at first because, I've talked every single time, but
thanks.
That's my feedback following up from last month. So thanks.
Madam Chair, this is Ty, if I could respond to that.
Yes.
I just want to clarify that my recommendation of Joanna was not to present on the topic, but to help us get a landscape of what meetings are occurring so that we could make sort of an informed decision around what space we should be engaging in the conversation with.
So maybe we could have Joanna ask her if she'd like to speak to get an idea of what's happening in the county. And I agree with the conversation. It's just, I believe there's things that are happening. There's pockets of money, people have prevention, but does the community at whole, are we doing a good job? Like, how do people access this information? How are they aware what resources are available? Because providers are probably aware of what's happening and resources, but to this general community, are they aware? And so I think it's just, for me, it's an awareness of what's out there, who can help, and just about the resources. So maybe it's starting with Joanna might be a good starting point. Crickets today.
Well, I agree. Daniel Davis again with you, Mom. I agree with that. I think that's a good place to start. My main concern is around providers being at the table when we discuss implementation, because I don't want a splintered approach to rental assistance like we've been experiencing through other CARES funding. So yes, Joanna first.
This is Sheila Schuster, and I really want to echo. I think it's a great idea to have a committee, and I'd be, even though I'm not a provider, I don't know how many of you attended the NAEH conference the last couple of days, but yesterday I was able to attend a session, and they were talking about prevention, and I think it's also worth noting that a lot of people already are doubled up or outside of an apartment. So like really knowing where to target people, and also like understanding like there probably is some gap. Like if we're looking at moratoria, they're going to be talking about people that have formal eviction notices. And there's a lot of people that don't necessarily have that, but they are going to be entering the homelessness system, that they're really high risk. So I just want to put that out there too, as something that might be a gap or a place where we really need to talk about it, because traditional CAP offices, or even the legal aid places or the court system, is not necessarily going to be the only place that we're going to need to go to find people that are going to, that we could be preventing from entering the homelessness system. So
I share your concern. I feel that this is going to be a huge issue when the moratorium is over, and we're going to have an influx of the system, and I feel that we're going to be overwhelmed, and I'm just scared for when that ends. And so yeah.
And Vanessa from ABC, another thing that stakeholder that we could reach out to, just thinking about what Chayla said, landlords. A lot of us have contacts with a lot of different landlords, and do they have all the resources they need to refer their tenants to eviction prevention? I think that's some of the way that we can use our reach in the community to help prevent this as much as possible.
This is Nikki Ramirez with CPLC. Can everybody hear me? I'm double checking just because I seem to be triple muted most of the time. And good morning. So I'm just going to volunteer a couple of things. I'm happy to participate in any work group. I'm happy to participate on what CPLC does as a whole in regard to eviction prevention, homelessness prevention, what our different programs are seeing. I'm willing to present on what our property management team is doing and how that is looking in comparison to what we're seeing other property management companies do. We have our finger on the pulse, I guess, of what the industry is doing as a whole because of the portfolio that we hold, and so we can speak to some of that. I also think that the ideas that have been presented so far are really great ideas, that we definitely do want to be connected and not repeat some of the work that's already being done in other groups, and just expand upon that and fill in the gaps. I think that as far as the volume of evictions that are happening, CPLC has taken an interest also in the level of equity in which evictions are conducted, and the potential race and ethnicity and the gaps that exist there. However, there is a lack of data that points to it. While we can connect, zip codes and the demographic data from the census tracts and those zip codes and look at high eviction rates, it's still not clear as far as partnerships with the courts and other things. So we're looking at things at that level. I don't know how much of that translates to what should be discussed within the COC. And so I'm happy to be a part of any group that is exploring that and what that looks like, and adding any information that we have in addition to just homelessness, but the housing spectrum of what we do as well.
Oh, thanks. So I do believe that we'll have we'll ask Joanna from the Arizona Housing Coalition to see if they can come and present. And then do we want to, as a group, wait for that presentation to see if we identify gaps based on that, or do we want to maybe put something together to present to the board recommending that we also form an ad hoc group if they would approve it? Okay. It's always hard when nobody says anything. So, all right, so why don't we just go ahead with having Joanna, and then based on that, we can, and maybe just as a group, if we can ask, just bring back some ideas or bring back resources for next time that we can talk about, like to identify some resources or gaps, and just to have that in the forefront. And we can bring that back next month as well and to talk about it. And after the presentation and what we've identified, maybe then suggest an ad hoc group to the board or present that. Good with that? Okay. All right, thank you. And then I guess if there's no comments or questions, we will have Stephanie with the next agenda item.
Thanks, Michelle. So similar to the eviction moratorium conversation, same thing for the move on strategy that we talked about last month. So just what an ad hoc committee would be doing, if we have any action steps, goals, and a timeline for that. We don't have the board direction or, priorities yet from them, but I am thinking one angle to take based on Ty's presentation today on system performance measures. Move on strategy is one of the strategies to use to make sure that homelessness is non-recurring. So I think that's an angle that we can use when we present to the board. And I really think all this might take is just a little bit of people's attention, like time and attention, to remind people that this is out there, there is something set up, and just revisit everything, maybe with especially housing providers that would be eligible to use this. And then also maybe this ad hoc committee could also reach out to the housing authorities to make sure that MOU is in place. If it's not, are they interested in implementing an MOU? So just some of my initial thoughts on this. You guys can tell me if it's good, if I'm way off.
Vanessa from ABC, I completely agree with those tasks that could be accomplished by this ad hoc group. And I would add, learning from, I know NAC had really great success with this strategy. So learning from NAC what worked, and to help inform the other PSH providers, so that we can have this successful for our overall continuum. But I would be happy to be a part of that ad hoc group as well.
Thanks, Vanessa. Anyone else? And question for you, Steve, about this. If I were to type something up that it'd be an action item to recommend an ad hoc committee to the board, if I wrote up like a paragraph of the intention, answering all the questions that they want answered, is this something that could be in next month's consent agenda? And then the following board meeting, it would go to the board?
Stephanie, that would be an appropriate, plan. Certainly when we're thinking about ad hocs, given the board and their process, the goal of the ad hoc would have to be identified. You know, proposed action steps would have to be identified. And then, you know, once that is set, the board would be able to look at that. And I see my colleague, Sarah Kent, who staffs the board, is on. I don't know if Sarah, you would like to respond, or is also Brandy Mead is still with us to respond in terms of process.
Yeah, I'd be happy to, Madam Chairwoman, if I may. Yes, so you really can go about it a couple different ways. You know, coordinating with your community members on the language that you want to be in this memo. You can send it to me. I can throw it into our, you know, into our letterhead and have it be, you know, if you think it'll be ready by the 29th board meeting, we can make that happen. Just let me know how I can assist on that.
All right. Thank you, Steve and Sarah.
Hi, Madam Chair, members of the committee. Wanted to just add to the comments that Steve and Sarah provided. I know that in terms of move-on strategies, there are technical assistance providers from HUD and other TA providers across the country that do provide move-on assistance type of training and information sessions. So that's something that if the committee were interested in receiving some national TA on this strategy, you could also, as another, maybe in addition to the ad hoc group, or maybe something that the ad hoc group is working on, is request some TA for our community around Move On, and then get that support from those national TA providers, as well as how to bring a successful Move On strategy to the region. So just another consideration as you're thinking about this topic.
Okay, thank you, Brandy. Any other questions, comments on move-on strategy? All right. Michelle will take us to our next agenda item.
I swear the tagline for 2021-20 is you're on mute. Anyway, so do any community members have any action or discussion for future agenda items?
This is Wendy Johnson from Justice Center. We had a disproportionate amount of transient deaths last year. A lot because there wasn't heat relief and resources available that were normally available. I'd either like to know what MAG is planning and at the next meeting, and or what we can do to increase life-saving. You know, what steps should we be doing? I think, you know, the pandemic has taught us that there's interrelated issues with the heat and access to safety. So I think it's really important we address that.
Thank you, Wendy. That's a very good point. Any additional future agenda items?
Okay, me again, Wendy Johnson, Justice Center. I would like to know about vouchers. So we use a lot of, I can't think of the name of the bootstrap voucher. I'm having an old person's moment. That age down, that they get less every time. I don't remember what they're called. Rapid rehousing, that's it. We seem to hand those out like candy here in the Valley, which is creating a return to homelessness that I'm seeing among my age group. I'd like to find out how we can expand to additional voucher programs, because I think rapid rehousing is right for some folks, just like permanent supportive housing. But, you know, we don't have Section 8 vouchers that are available. And there are people who aren't permanently supportive housing certified, but definitely will never get a job and be able to pay their rent after 6 months. That for me is a recidivism issue, and I guess I should ask Ty for some data on that. I think we need to discuss as a community how we want to help people, and I'm not a big fan of rapid rehousing as a one size fits all. So I'd love to go into that more. And now I'm done with my ideas.
You're very valid points, and I think that's it's worth a certain discussion as well. I know sometimes in the veteran community where we have SSVF, we'll be working with the rapid rehousing, and if a veteran's not successful, then we can do I'm gapping on the name, but put them into HUD bash. So we could say, okay, you know what, now they're going to need a voucher because they're not successful.
Thank you for a senior moment, so I don't feel so bad there.
Yeah.
Thank you.
You're welcome. All right. Are there any agenda? All right, we'll move on to Stephanie.
All right, final agenda item. Any comments from committee members? Anything for future agenda items? Good news to share? I have good news to share. Our Dunlap Point is a 54-unit site-based permanent supportive housing project opened late last week. We can only occupy the first floor of it, but we have the first floor moved in, and as soon as the city gives us the rest of the building, we'll be able to get folks moved in there. And next week, our second treatment center will also be opening. So that's just shy of 50 inpatient residential treatment beds for folks with substance abuse. We'll be having a grand opening on the 24th. No other comments from committee members? If none, then our meeting for today is adjourned. Thanks for joining. Everybody have a great day.
So do we have to have a motion to dismiss?
No.
Okay, good.